Hello, friends. I am Dr. Njwepi Joe Chedo. I am a medical doctor and a GI tract proctology surgeon. Today, I bring to you the health tidbits. And our subject of discussion today is the exemption from intermittent fasting. Who are the people who should be excluded from intermittent fasting? 1. Pregnant women. If a woman is pregnant and is having a baby in the womb, the baby needs calories regularly. And even the mother herself needs the calories regularly. And that is the reason why a woman who is pregnant should not practice intermittent fasting. That baby in her womb needs to grow harmoniously without deprivation from any type or any source of food. The next person is a breastfeeding woman. If a woman is breastfeeding, she has to supply breast milk to her baby. And the baby needs that breast milk round the clock. And so, such a woman who is breastfeeding should not practice intermittent fasting. Infants and teens right up to 18 years who are still in their growing period should not also practice intermittent fasting because they need to grow. So they must eat regularly and make sure they eat balanced to make sure that they grow without any deficiencies. People who are already thin and underweight are not advised to do intermittent fasting. People who are malnourished for one reason or the other. Malnourishment means that they are sometimes in lack, in complete deprivation. They don't have the food. Such people, again, you should not impose or recommend any intermittent fasting to them. Now, there are some medical conditions that would not also tolerate intermittent fasting. People who are having eating disorders like anorexia nervosa, or that we just simply call anorexia. There are some people who are so obsessed about their weight. They always feel that they are going to have overweight. And such people, you see them depriving themselves of food, and they don't even, they go to the gym all the time to make sports, to do sports in order to continue to have normal weight, which in reality it is just a medical condition in which the person is always thinking that he's going to be overweight, and because of that the person does not even eat enough. Such people who are anorexic should not be allowed to do intermittent fasting. And then the next medical condition which we will not recommend or that will exempt that person from intermittent fasting is somebody who is having bulimia. Bulimia is somebody who eats a lot. He eats a lot, but he also comes to the situation where he eats a lot and then provoke vomiting, and also takes a lot of laxative to push his himself or herself many times, and such people too are having a disease which make them to be obsessed of too much eating, but even without eating, they also provoke vomiting and take laxative to empty themselves. And so sometimes they even go without even eating because of the too much laxative that they take. And such people, we should make sure that if they are around us, they should seek medical advice and they should not take or undergo intermittent fasting. Thank you, ladies and gentlemen. Share this information. Share this information and make sure that you stay safe.